Welcome to the Holistic Oral Health Summit. I'm your host, Jonathan Landsman. Did you know that 80% of disease symptoms are related to problems in the mouth? As a health and fitness consultant for nearly 30 years, I believe this is one of the most overlooked problems within conventional and integrative medicine. That's why I created this summit, to help you identify, prevent, and eliminate the roots of disease. Our show today, Medical Alert, Root Canal Procedures. Our guest received his dental degree from the New York University College of Dentistry, and he received postgraduate training in implant surgery and implant restoration, sponsored by Brookdale Hospital in Brooklyn, New York. He abandoned much of his traditional dental practice after learning of the risks of some of the dental procedures he was performing. Subsequently, he only performed oral surgery and has not actively practiced dentistry since 2006. His first book, The Roots of Disease, with co-author Dr. Thomas Levy, who's a part of this summit, introduced many of the concepts that his latest book, The Toxic Tooth, expand upon. Reluctant at first, our guest finally agreed to write his latest book with Dr. Levy and quickly realized that the abundant new information that's out there and compelling research that's been published since 2002 justified the completion of this new book, The Toxic Tooth. Please join me in welcoming Dr. Robert Kulaz. Dr. Kulaz, welcome.
Great to be with you.
Dr. Kulaz, why don't we first start, for those who aren't familiar with it, and I say it that way because a lot of people, they have root canal procedures that were done. They don't even remember what tooth it was. Let's talk about this. What is a root canal and why is it performed?
That's a great question to start. A root canal is performed when, generally speaking, it's done when the infection from a cavity has gotten so deep that it has invaded the pulp tissue, the inside center portion of the tooth. And that's actually the root canal space in the tooth, which houses the blood vessels and nerves of the tooth. And once that inside part of the tooth has become infected, then there's no turning back. The tooth either has to have a root canal or an extraction. And you'll normally see, a dentist will know that the tooth has become infected because, A, the patient will have pain on that tooth, pain to temperature, like hot or cold. And they'll also see on an X-ray, in the surrounding bone, they'll see an area, a dark area, which indicates that that bone that supports that tooth has been resorbed by the infection. You'll see a dark area on the X-ray. And once you see that, and once that pulp has become infected and died, the dentist will normally perform a root canal. Now, what is a root canal? Well, a root canal is done when the dentist enters and removes all of that decay that has caused the initial infection, and then they insert these long barbed instruments into the canal all the way from the top of the tooth right on down to the tip of the root in the attempt to remove that infected tissue and then to widen and shape that canal space. They'll use larger and larger files and then scrape the walls of the canal and in between the instrumentation put in antimicrobial agents in an attempt to remove the bacteria that had infected the tooth. The goal is to widen and shape that root canal space, sterilize it, and then seal it with a root canal filler, all the way from the top of the crown portion that you see in the mouth, all the way down to the tip of the root that's in the jawbone. The problem is you can never fully sterilize the tooth. There's always going to be infection remaining after the root canal is completed.
Dr. Kulaz, we're going to get into that in just a moment, but I thought as I was listening to you, we should talk about this for a moment. And what I'm referring to is, a lot of times when I talk to back specialists, right, they'll say, and they're into holistic health, they'll say, my goodness, even over 90% of back surgeries are unnecessary. And God forbid this ever happens to someone, but they might be diagnosed with cancer or some other serious health condition and say, wow, we got to get this done, some sort of serious surgery. You got to take some toxic medications for a while because you're labeled with something so horrific. But what I'm getting at is, the bottom line is, they didn't even need it. Now, I know you can't speak to everyone's specific situation out there. I mean, we've got tens of thousands of people listening to this program at any one moment in time. But just generally speaking, am I far off base by saying that many people who actually are told quickly by a dentist, because they went there with pain, oh, wow, we got to get a root canal procedure done. We got to do it right away. This will fix your problem. Could that be a total mistake?
Yeah, that's a very good point, Jonathan. But in this case, I think generally speaking, the patient will come in with, usually it's pretty severe pain on the tooth. And then an X-ray, when you see definitive pathology on the X-ray, in other words, you see the decay or the amount of tooth destruction reaching the pulp tissue, or you see that infection in the surrounding bone, That's pretty definitive. There really is no gray area there. Certainly, there may be some dentists who will say to a patient, yes, we should do a root canal on this tooth, and there really is no infection. But if somebody is walking into the dental office with severe pain, usually it's indicative that the tooth has become infected and a root canal will be required. But yes, I think there is a subset, probably a subset of people who, like in any procedure, they're told they need something and they really don't.
So let's talk about this a little bit. We're going to get into the anatomy of a tooth and why this anatomy makes it impossible, as you sort of mentioned at the end there, just as you were talking about root canal procedures, why it's impossible to sterilize an infected tooth. This is interesting.
Well, that's a great question, because that really is the crux of it right there. Now, if the tooth, let's go back and review the anatomy. The tooth has a pulp chamber, which is the center portion, like the core of the earth, basically, the center portion of the tooth on the crown section of your tooth, and then it has these canals that run the entire length of the root, much like a paper towel roll has a hollow center. Picture that as your root. Now, that center canal is often curved, and it also has small tributaries or branches that come off the side that go laterally, and they could be very numerous in a tooth, and you can never access those lateral canals. But more importantly, the body of the tooth is not solid. The dentin, which is the structure that comprises almost all of the tooth, is porous, like a sponge. It's composed of millions and millions of small little dentinal tubules. And these run out from the pulp chamber. They run out from the root canal space all the way out to the end of the root and the tooth. These tubules, if you were to stretch them, put them end to end on, let's say, a front tooth, they would stretch for 3 miles. There's a lot of them in a tooth. But they're big enough to house bacteria 3 across. So all of these dentinal tubules, when that tooth has become infected, the bacteria migrate into these tubules, and they, like water into a sponge, and they can live there. No amount of instrumentation, no amount of antimicrobial irrigation, no laser can touch these bacteria. So all root canal teeth that are infected to begin with will stay infected after the root canal is completed, period. You cannot sterilize an infected tooth with a root canal.
And, I'm just curious, do conventional dentists understand this concept? And I know you were conventionally trained. Was this ever discussed in dental school for you, or do you know for the profession in general?
Well, in dental school, when I went to school, we had to culture, take little paper points and insert the paper point inside the tooth and then send it off to the laboratory to culture for bacteria. And if we got back a positive culture, meaning there was bacteria in that canal space, we had to continue to irrigate and instrument the canal. The goal was that at that time that you could, quote, sterilize a root canal tooth. And once it was sterile, you would seal it and you could complete it. That's what I was taught when I went to school. Most dentists today, a lot of them still believe that once you instrument and irrigate that root canal, that it is sterile, which is wrong. Other dentists believe that once you seal that root canal, once you put the root canal sealer in, that the bacteria will become entombed inside that tooth and can pose no health threat. And that's simply incorrect.
It sounds very similar to the other programs we have here as part of the summit. This concept, this false concept, you're taught this idea that, like you say, they can entomb it, like with mercury as well. They're taught the same thing. Oh, you have some mercury, it's quite toxic, we know that. Oh, but don't worry about it, it's in a silver filling, just put it in mouth, no problem at all, right? It's the same thing.
It's the same thing. Yeah, on the mercury issue, I just was reading a dental internet site. They were talking about mercury, and there was one dentist who commented and said, oh, the mercury in dental amalgam is the safe kind. So you wonder what we're dealing with. There is no safe mercury. So, yeah, it's true. The belief system that's set up in the profession and what is written as ADA guidelines are not necessarily based in fact.
Yeah, and this is really what leads me to a very important part of this program, I am sure, especially for the dentists and the dental assistants out there that are listening to this program. Dr. Kulaz, let's talk about how a root canal treated tooth becomes more infected over time. Really take us through this process.
Okay. Normal teeth have blood vessels that enter the tip of the root, go up the root canal, and supply blood nourishment to the inside of that tooth. With that blood supply, you have a fluid flow, or a positive flow of fluid from the pulp chamber, from the root canal space, from the inside to the outside of the tooth. And in essence, what that's doing is preventing any bacteria from migrating in from the outside of the root surface into the dental tubules, getting inside the tooth. This positive fluid flow pushes the bacteria out. However, once you have a root canal, there's no longer a blood supply to the tooth. That tooth is dead. So that fluid flow, that normal fluid flow that would cleanse those tubules of bacteria trying to migrate in, is no longer there. So in the gum pocket, in the pocket around the gum tissue around that tooth where the bacteria in the mouth reside, these bacteria can now very easily migrate inside the tooth, and there's nothing to keep them out. There's no fluid flow, there's no immune cells. Those bacteria just keep on coming in. So over time, that tooth becomes more and more soaked with bacteria, becomes more and more infected. Also, no dental restoration is perfectly sealed. So bacteria can migrate in, and secondarily, through leakage in the dental restorations. So after a root canal is done, that tooth is going to be infected, and it will get more infected as time goes on.
You know, nothing is 100%, but Dr. Kulaz, it seems like what you're explaining right now is just increasing the ability and the risk of us to collect all of these toxins in one place. As I listen to you speak, it sort of makes me think of like a root canal treated tooth as sort of an enclosed shower stall where the water can't get out, but all the gook is getting collected too in the corners and in nooks and crannies. And if you just keep neglecting that year after year, you know, couple that with really poor eating and a very depleted immune system, and I think you have some, you know, the makings of something really quite serious there in terms of collecting a lot of toxins that then can pour into the rest of the body, no?
Exactly. It's not only, it's the bacteria, but it's also the small molecule exotoxins that these bacteria produce. Well, Dr. Boyd Haley did some brilliant research to test and see what kind of toxins were coming out of these root canal teeth. And what he found was these very small molecule exotoxins were being leached out of these root canal teeth, and he tested them against 5 key enzymes in the body to see what type of inhibition, if any, would these toxins produce. And what he found was that over 3/4 of root canal teeth would inhibit these 5 enzymes that he chose almost entirely. And he would compare and reference the toxins from these root canal teeth with a known toxin, hydrogen sulfide. And he found that the toxins that the root canal teeth were releasing were even more toxic than that. So yes, these teeth release very, very potent exotoxins that can damage biochemical enzymes in the body.
So naturally, a lot of people, Dr. Kulaz, are going to be thinking about this, what I'm about to ask you. Like I said before, nothing is 100%. We know we live in a toxic world. There's all kinds of gooky things out there, right? So why can't our immune system take care of an infection like this? What do you say to people who just figure, well, my immune system will handle this?
That's a very good point. An interesting article that was just published in 2014 titled Pathogenic Bacterial Species Associated with Endodontic, that means root canal, Infection, Evade Innate Immune Control by Disabling Neutrophils, which are a white blood cell. These bad bacteria can actually wipe out and inhibit antibodies and the white blood cells designed to destroy them. The same argument could be made is, well, why can't the immune system knock out a cold or a bacterial pneumonia or some other infectious disease? Sometimes these bacteria evade our immune system. And they can do it by, they can hide within white blood cells. They can shed an antigen, which is the coating on the outside that the white blood cells and antibodies recognize as being foreign, into the bloodstream, similar to what a fighter plane will do when it emits, chaff to try to evade a missile. It can suppress antibodies, and it can produce toxins that also hinder the white blood cells that try to eat them up, and they neutralize the white blood cells and immune complexes designed to attach to them that will enhance that phagocytosis or that gobbling up of the bacteria. So, yeah, the immune system is a very, very, very good thing, but it can't always protect us from these pathogens.
Dr. Kulaz, also, I'm going to just say the obvious, and I'll get your comments on this. When we look at, like, say, a 25 or a 30-year-old person with 1 or 2 root canals, and it's just so easy for a healthcare provider out there to sort of discard everything that we're talking about here. This is not such a big deal. Why are they playing this up so much? Why are they saying that root canal treated teeth could be such a health risk to the human body? When you're looking at a 25 or a 30-year-old that has a root canal treated tooth, maybe 1, 2, or even 3, whatever it might be, for 2 or 3 or 4 years, and, they're doing pretty well in their health. But who knows with these people? They go 15, 20, 25 years. There's emotional stress. There's a lack of nutrients in the body from, mishaps with the way that they're eating. toxic exposures, whether at work or in the home with furniture, and how the air is and how toxic their water supply is, because maybe they moved from one town that didn't have fluoride in the water. Now all of a sudden they're drinking water with fluoride in it. I mean, I could go on and on for 30 minutes as to how basically what I'm trying to say is the immune system gets worn out. Now, all of a sudden, that root canal treated tooth that was a source of all these toxins is just, the one thing that is just too much for that person to handle. What are your thoughts on what I'm saying?
That was well said. It's exactly what happens. It's like an orchestra. You have an orchestra with a whole slew of instruments, and they're all playing beautifully in tune, and you have one instrument playing a little bit out of tune. Maybe you don't notice that, but you have a whole bunch of instruments playing out of tune. Now, all of a sudden, it's no longer music. And that's what happens in the body. Yes, like somebody who is young and healthy, they can handle maybe they can handle very well, 1, 2, 3 root canals, maybe, and even maybe their whole life they can handle it. But it's that potential risk of just accumulating assaults on the body and weakened immune systems that can make us sick. But you put it very, very well. It's not a linear thing where you'd have a root canal today and you're sick tomorrow. Sometimes it is, but generally speaking, it's the combined assault that will get us.
And I say it this way, Dr. Kulas, because I know there are a lot of people out there who are really into holistic living, natural health, a lifestyle that's healthy, and they have taken all these great quality supplements. They're eating well, and they're trying so hard to overcome agitation in their nervous system, and emotionally they feel like they've got troubles. Or even on a physical level, they're still suffering with head pain or chronic fatigue. And this might really explain as to when all of this started, if they can just connect it to actually having a root canal treated tooth, no?
Yes, indeed. Indeed. Certainly it's very difficult to say definitively, in patient A that their disease process is definitively caused by a root canal tooth. But we can say that these root canal teeth are toxic. They release potent exotoxins. They release bad bacteria into the body, and certainly they may be the main cause or a contributing factor in a host of various diseases. And one disease, well, let's just talk about heart disease, for example. Now, the latest studies are showing that heart disease, cardiovascular disease, or the buildup of plaque in the arteries, and heart attack is really an inflammatory process. And cholesterol is really a byproduct. The cholesterol is not the main cause of it. It's a damage to the inside lining of the blood vessel, then the migration of cholesterol inside that artery into the inside part of the arterial wall. And the heart attack is caused by an inflamed plaque, a rupture of the inflamed plaque in that artery that breaks through the wall of the artery into the lumen, or the hollow portion of the blood vessel, causing a blood clot. And in 2013, a study came out where bacterial signatures in thrombus aspirates of patients with myocardial infarction. And the conclusion was dental infections and oral bacteria, especially viridin streptococci, may be associated with the development of acute coronary thrombosis. Bacterial DNA, typical for endodontic infection, that's root canals, mainly oral viridin streptococci, was measured in the thrombi. And periodontal pathogens was also, from the gum, was also a contributing factor. So these bacteria from these root canal teeth, these bacteria from the gum tissues, travel from the mouth, go to the heart, go to the arterial plaques inside the coronary arteries, and that could be a major contributing factor to the development and progression of coronary artery disease, and also to the inflammation that causes that plaque to rupture and causing a heart attack. So we have a smoking gun here. It used to be said, it's correlation that oral infection can cause heart disease. This is more a direct causation. We're seeing the same bacteria in these root canal teeth, in the gum tissues, in the plaques and coronary arteries.
Well, and of course, what you're referring to is that conventional dentistry would say, well, that's just something that's there, but it didn't really trigger it. There are so many other things that could cause that clot and that kind of heart disease. But boy, are they really neglecting some of this toxic issue of a root canal treated tooth. Are there other toxicities that we should know about? I know you do a lot of research in the subject. Other things we should be aware of about what's spitting out from these root canal treated teeth?
Well, like I mentioned before, it's two things. It's the bacteria, the bad bacteria that can, A, migrate from the root canal tooth and the surrounding bones to other parts of the body. And as Boyd Haley actually thinks that the exotoxins that I mentioned earlier may even have more of a disruptive effect than the bacteria. These are very, very potent toxins, much like botulism toxin or tetanus toxin. And these are produced 24/7 inside these root canal teeth. And no amount of root canal sealer or filling that root canal space can prevent these very, very small molecule toxins from escaping. They just migrate readily out of the tooth into the bloodstream, and they travel to other parts of the body.
Dr. Kulaz, we just spoke about the health effects of a root canal treated tooth on, say, the heart. I mean, that's serious enough. We have a lot of people out there who are suffering with cardiovascular disease, and they mean well. Again, eating well, taking supplements, trying to reduce their stress load, hopefully, right? But this is a very direct effect. Are there any other effects that we can talk about that a root canal treated tooth could have a serious negative impact on somebody's health?
I think there's a whole list from arthritis to, kidney disease. The list can go on and on. You can read that list in the book. Wherever there can be an infectious component of disease or a toxin-associated disruption causing disease, root canal teeth can do it. Just another interesting article I have here talking about cerebral aneurysms in Journal of Neurology. It was published back in 2013. The connection between ruptured cerebral aneurysms and rhinogenic infection. Conclusion. This is the first report showing evidence that dental infection could be part of the pathophysiology of intracranial aneurysm disease. So these bacteria go everywhere. They're going everywhere, so they can affect your heart, they can affect the blood vessels in your brain, they can affect your kidney, they can affect your lungs, they can affect your brain. It's, I just wish the American Dental Association would just say, hey, listen, we have to look at this seriously now. We can't no longer bury our head in the sand and say, these root canal teeth can pose no health threat whatsoever. That's their position, that the bacteria in these root canal teeth do not travel to other parts of the body, and that these bacteria and toxins do not cause any other disease. And that simply is not true.
Yeah, I mean, the way you're making this sound, it's not based on science at all. I want to be perfectly clear about that. That's the message I'm getting from you. And it really sounds like they're like the tobacco industry. All the top tobacco experts, they're going up in front of Congress. They're saying, there's no way that our tobacco and our products are causing any kind of health problem at all. I mean, they're just saying it, but they're not basing it on anything scientific at all. Is that fair to say?
And that's how I view it. I look at the positions of the ADA, and rather than saying, hey, there may be a health threat here, and that overrides the status quo of the profession. In other words, yes, dentists make their living doing these root canals, and a lot of them have been done, 25 million plus per year. I understand that they don't want to admit that, hey, there may be a problem with these, because there would be a whole slew of lawsuits going back many, many years. But I think ethically and morally, you have to say, is the procedure that we're doing a health risk? And if it is, let's inform the patient. Then it's up to the patient to decide if they want to have one or not. I'm not saying don't do them, ban them, but I'm saying inform the patient. Tell them, here's what these teeth actually are. They're going to stay infected. They can release toxins. They can release bacteria. Here's the study showing what they can do systemically, and then have the patient decide whether or not they want to have the root canal.
Dr. Kulaz, I think this is probably a very good time to jump in and just sort of put aside this question that a lot of people might have on their mind as to some of the things that you were just referring to about how a root canal treated tooth could affect the heart. It could affect the kidneys. It could affect the brain. I think a normal question that people would have is, well, if somebody had a root canal treated tooth, why isn't it affecting everybody's heart or everybody's brain or all of those things all in the same intensity? Now, we talked about the difference in immune strength with people, but isn't there also a connection between certain teeth and the rest of the body? And I just want people to appreciate that. Can you speak to that a little bit?
Well, I'll answer the first part of the question. It's like people who smoke. A lot of people are smoking, but they're still walking around without any observable disease. So the same way people are walking around with root canal teeth, you're not going to see, people getting a root canal, like I mentioned before, today and becoming sick tomorrow. That's not going to happen very often. As far as the energy meridians, I'm not familiar enough with that to comment. I know I've read about it, and I know people do associate, certain teeth with certain organs and in the body, but I don't have enough experience to make comments on that.
So it is fair to say, though, then, that any of the root canal treated teeth, then, when you talk about the toxins that are being released at anywhere in the mouth, in your expertise, they can affect the heart then, right?
It's a long-term progression. People don't develop heart disease overnight. It takes many years for the progression of that arterial plaque to develop. Then eventually that rupture of the plaque that causes a heart attack. It's not an overnight thing. So that root canal that somebody had when they were 20 and the heart attack that they got at 55, you would never think that, it's a root canal. There may be a factor in this. Now, it's not the only factor, but it could be one of the factors over that time span that caused the progression of disease and then the eventual heart attack.
Well, I know this part of our discussion is going to be of great interest to those open-minded dentists out there who are looking to really, get involved in another area of their practice, but most definitely for anyone about to get a root canal treatment of some kind on a tooth. Why don't we talk about the correct extraction technique of a tooth, and is it necessary to do a tissue biopsy and cultures? Talk to us about this.
Well, there are many ways to go about extracting a root canal teeth that I'm sure would end up with the same result as my procedure. But the first thing that I would recommend is never to use an anesthetic that contains epinephrine. Epinephrine is a vasoconstrictor. It constricts blood vessels. So what we want very good blood flow to those tissues. And the jaw, especially the lower jaw, the way the blood comes in and goes out, even a transient ischemia or even a short loss of blood supply can damage the bone cells, and we don't want to damage the bone cells. I never used epinephrine. I did large surgeries and didn't find I needed to have the epinephrine to keep an anesthetic in place any longer than we needed for the procedure. So the first thing is don't use epinephrine. The second thing is remove the tooth as atraumatically as possible. And that means if it's a molar with 2 or 3 roots, section the tooth. Take it out in pieces. It's much easier to remove a tooth in one root at a time than to try to take, divergent roots out through a small opening. What you end up doing that procedure is you end up fracturing the bone. Third thing is never elevate or take an elevator that is used to luxate or rotate teeth. Never use that against adjacent teeth, because what you'll do then is if you use the adjacent tooth as a lever or as a fulcrum, and you move that tooth, you got to picture, a lever and fulcrum. As you go further down that root, a small movement of the tooth at the top can cause a large movement of the tooth at the end of the root. And if you sever and you move that tooth too much and you sever the blood vessels that are entering that adjacent tooth, that tooth can become compromised and can die. Then I like to lay a flap, and that's removing or making an incision where you gently lay the gum back adjacent to the tooth you're extracting. Once you lay that gum back and you section that tooth, you try to remove that tooth as atraumatically as possible. Once that is done, I will immediately take cultures and a biopsy of the tissue at the base of the tooth socket. I want to see what bacteria are there. I want to see what that bone tissue looks like under a microscope. Once I've done that, I'll start to remove any bone that's in between the roots, and I'll also remove the bone surrounding the entire perimeter of the tooth socket for 2 reasons. One, there's a ligament that holds the tooth into the socket, and you want to remove that. And secondly, you want to remove the bone that is holding, the cortical bone that's holding that tooth in place, because the body has to resorb that bone anyway. The body is going to attempt to remove that bone and then lay down new bone just to fill in that socket. If the body does not remove that bone, you'll get a cavitation. You'll get incomplete healing in that socket, and that's not good either. So I take a low-speed drill with a round burr with copious amounts of sterile saline irrigation, and then I'll remove the bone around the perimeter of that socket in entirety, and usually about a millimeter or 2 further out to try to ensure that I have healthy bone and I have good bleeding bone. Without blood, you don't get healing. So I'm removing the bone that the body has to remove anyway and resorb anyway before it can heal properly. I'm just giving it a little head start. Plus, I'm removing any infection in that bone from that root canal tooth. How do I know when I'm done? Well, you don't know exactly when you're done. You try to go to healthy bleeding bone, and hopefully you've gotten past the point of infected bone. And that's when I use the initial tissue cultures to see what kind of bacteria are there. If they're bacteria that respond to simple oral antibiotics, we may just give a short course of oral antibiotics. Sometimes we'll find very, very bad bugs in there, and patients will require IV antibiotic therapy over a prolonged period of time.
So just to be clear, Dr. Kulas, the importance of removing the ligament when you're taking out the tooth. Talk about that. And also when you're talking about removing bone, right? My first thoughts were, where do we get bone to put it back? Is it necessary? Where do you get that material from? Talk about that as well.
Sure. As I mentioned before, the ligament is the sling, if you will, that attaches the tooth to the tooth socket. So most dentists will just take a charrette and they'll scrape the tooth socket trying to remove that periodontal ligament. Well, that's good, but I think you have to go further. You got to have to remove that ligament and also the supporting socket bone, the bone that's comprises a tooth socket. And if you do that with a round burr, you're going to remove the ligament automatically because the ligament is just the first layer. So using the round burr with slow speed and sterile saline irrigation, you're taking away that entire socket wall. Now, where does the new bone come from? Well, you can use a bone graft, but if you've done the surgery properly and you have good blood flow, the body will make new bone by itself. You don't need to put bone back in. The blood supply and good blood supply to that area, good bleeding, will start forming new bone immediately. So you don't need to get bone anywhere else.
Is it fair to say that there are many conventionally trained dentists who, might look at doing a procedure like this and they sort of look down on the idea of encouraging bleeding and try to purposely stop it? Is that what you were sort of saying before about the kind of anesthetic that they might use and why they might see that actually as a benefit to cut down on the bleeding?
Yes, they do, and they'll use, and even using an injection technique called a PDL, or a periodontal ligament injection, where they will inject anesthetic between the tooth and the bone under high pressure and force anesthetic down, that space between the tooth and the jawbone. Now, if you have an infection in that tooth, the last thing you want to do is put anything under high pressure into that space, and you do not want to use, epinephrine to cause blood vessel constriction and lack of blood flow. Dentists don't really, I don't want to put them down, but they don't understand that you need blood, you need bleeding. Bleeding is what's going to give you life. It's what's going to give you healing. And dry sockets, for example, dry sockets occur usually in the lower jaw, usually in wisdom teeth area, when the blood clot breaks down, and it's a very painful situation where the blood clot that was in that socket breaks down, the bone becomes very inflamed, it's very painful, and the dentist has to go in and try to induce bleeding. Not after the dry socket's formed. Well, the dry socket shouldn't form in the first place. It shouldn't form because if you don't use epinephrine and you remove that bone socket, that cortical bone in that socket, and you induce good bleeding, there's no reason a dry socket should form in the first place. So yeah, it's a technique problem that dentists, they were taught this in school. It becomes just the way of the world, and I don't see it's going to be changing anytime soon, certainly not from hearing me talk.
So, Dr. Kulaz, obviously, people are going to want to know. We've gone through this whole process about the health dangers associated with a root canal treated tooth. We get it. It could affect you in so many ways. We talked very well about how you consider it a proper extraction technique. But now let's talk about those options after the tooth is pulled. What do we do?
Oh, that's the big question, Jonathan. What do we do? If it's a second molar or the very back molar and you're an older person, you do nothing. You'll function quite well. If it's an important tooth, a front tooth, an important chewing tooth, the least invasive option is a removable appliance, removable denture, something you take in and out of your mouth. Usually it's on either a plastic or a metal base, and this metal base goes around your teeth, around your palate if it's an upper appliance, or behind your lower teeth if it's a lower appliance, and then you attach teeth to it, and you take it in and out at night. The second option is a bridge, and a bridge is where you would cap either side of the empty space, and to those caps you'd have, let's say it's a 3-unit bridge where you're missing one tooth. You would cap the teeth on either side of the missing space, and you would attach a tooth to fill in that missing space to those two caps. So it would be a 3-unit piece that would be cemented on those two abutments teeth on either side of the space, and you'd have a bridge. It would be permanent. It wouldn't come out. You'd have to clean underneath it and around it, but it would be much like your own tooth. These can be made of porcelain. They can be made of zirconium. They can be made of porcelain on a metal. And if you're going to use a metal substructure, I would recommend the highest noble metals like gold rather than some of the more reactive metals. And I would also recommend not putting dissimilar metals in the mouth. In other words, don't have one metal in one part of your mouth, another metal in a different part of your mouth. You can get a galvanic or a battery-like response, which is not good. And the third option, this is a controversial one, is a dental implant. A dental implant is placed into the bone. It simulates your natural root of your tooth. And it goes into the space, the healed bone. I like to put it after the bone is healed, not immediately after extraction. And a hole is drilled into the jawbone, and an implant is placed into that hole that was drilled where the missing tooth was. You wait 3 to 6 months for the bone to lock and integrate to that implant, and after that amount of time, you can restore the tooth with a crown made of zirconium or porcelain or whatever material that you choose. I like zirconium because it's probably the most bio-inert material. Now, some dentists will immediately restore these implants. I like to wait till that bone is fully matured and healed before restoring it. Now, what type of implant do you use? Well, there are two kinds. One is a titanium alloy implant. That was the first implants that were used in dentistry. And there is some controversy on that. The controversy is having metal implanted into the jawbone. And I'm going back and forth on this one. That one aspect is that in the literature, there's been reports of these ions, these metallic ions coming off the implant, causing a localized reaction, going to other parts of the body, causing a systemic reaction, and causing an allergic reaction in the body and raising your allergy potential. And that's something that concerns me because people who have known metal allergies would be more prone to this allergic response with these implants. So if you were to have a titanium implant, and by the way, it's not just titanium in the implant, it's titanium and other metals too, even nickel, which people have allergies to nickel. I would recommend having an allergy test for metals before considering doing a titanium dental implant. The other implant is zirconium, and zirconium does not have the same metal ions that titanium has, and I believe is probably going to be a much more bio-inert and biocompatible implant than the titanium. So my feeling is if you're having an implant, I would go zirconium, not titanium.
Dr. Kulaz, I want to thank you so much for your time today, and I want to thank our listeners for joining us today. If you would like a copy of this program, plus all the other presentations inside the Holistic Oral Health Summit, simply click the banner you see on this page. Thanks again for attending the Holistic Oral Health Summit. Talk to you soon. Take care.